My name's Mandy and I'm your host today, and I am joined by Sue. Hello, Sue.
Hello, how are you?
I'm good, thank you. How are you?
I'm good, thank you. A long time since we've been here.
Bear with me, we're just having a bit of technical issues here. Won't be a second. We're back from school holidays, I think that's the issue, isn't it? Aha. Hopefully everyone can hear me now. I didn't have my button on, apparently. So I'm going to start again. Welcome to Keep Women's Talking, a programme from Peterborough Women's Aid. My name's Mandy, I'm your host, and I'm joined by my co-host Sue. Hello.
And I think they heard me, but only heard one side.
So we know that you're okay, don't we?
I'm good, thank you.
Good.
You?
I'm good, actually. I'm feeling enthusiastic. I'm feeling excited.
Can't we tell Mandy's been on holiday?
I've been on holiday. The kids.
And I haven't yet.
The kids are going back to school tomorrow. Should we be joyful about that or not? Or am I just a bad person stroke mother?
I think it's been a long summer holidays for some, hasn't it? And it's always so difficult to keep them entertained over the 6 weeks and that as well, and can be very expensive.
Yeah. So you're saying I'm not a bad person or mother?
I think it's just nice just to be able to get back into that routine.
Yeah, that's what we're saying. It's nice to have a routine.
Normal life,
yes, we are. So if you're watching us on YouTube, you will see that we are joined by two guests today, which we are really excited about. We have Danielle Black, who is our Integrated Neighbourhood Programme Manager, and we will find out what that means in a mo. And we have Dr. Ruth Beasley, who is a GP at Burraby Medical Centre. So I'm going to come back to you both in a minute. We're just going to do some Peterborough Women's Aid catch-uppy type stuff. But Sue, I wanted to ask you about something that was in the newspapers this morning. And there hasn't been an official response on this, but when I read it, I was like, oh my goodness, good for her. So basically it says that Queen Camilla, there was attempted assault on her when she was 16 or 17.
When she was younger. I was going to say,
Yeah.
please not now.
No. And she was on the London Underground, and it said in the press and the media that what she did was she took her shoe off and hit the assailant on the head with her high heels.
So she defended herself.
She defended herself. And you know when you read something and that just brings a smile to your face.
Yeah.
I don't condone violence.
No.
No.
What I was going to say, we don't condone violence, but in that situation, you think good on her.
You do think good on her. Now, I've met the Queen.
Oh, have you?
I have, yeah.
You were pally with them?
I'm not pally, but I met her. She came to a refuge that I was running in London. What a lovely lady. This was when she was Camilla, not Queen Camilla.
Right, a little while ago.
Quite small.
Is she?
She's tiny.
Oh, she doesn't look tiny.
She doesn't look tiny, does she?
No.
But she was so knowledgeable about domestic abuse, really wanted to help, had done a lot of research about the work that we were doing. She's just a really, really, strong advocate for violence against women and girls. And the fact that she hit someone with a heeled shoe just makes me love her even more.
Even more.
We have a question of the week, don't we? So because we have our colleagues from the NHS, we are asking, what does well-being mean to you? Sue?
To me, it's all about just taking time for yourself and doing something for you. And that, as we've spoken about numerous times, we both enjoy going to the gym and taking that time for us. And I love a spa day. I so love a spa day.
I had a spa in Turkey. Have I told you this?
Oh, I think you did, yes.
Have I told it on the show,
About
though?
your, I don't know what you'd call it, your experience.
I felt like I was being physically attacked at one point.
You got scrubbed.
I got scrubbed, and then I got cold water thrown at me, and then I got bags of bubbles chucked on my face. It wasn't relaxing at all.
But I'm sure it was very good for your skin.
It was. I mean, I came out glowing,
Yeah.
but it wasn't enjoyable. So well-being for you, Sue, means just taking time to yourself. We both like going to the gym, don't we?
Yeah.
And just having that
Just
time.
space and time for you to gather your thoughts, clear your head a bit.
Yeah.
Do you find that when you're running that it has that impact for you?
Yeah, and I'm really trying to focus myself on when I go running or go to the gym. I have my earpods in, whatever, I can't remember what they're called, iPods, earpods. And I've often listened to a podcast, but I've tried really hard to focus on the podcast, otherwise my mind wanders off to work stuff.
Yeah, so it drifts.
And I think actually I'm still working in my head here. I'm just running and working. So I try to really focus on not thinking about work and
switching off and having that time.
Focus on what I'm listening to, which is normally podcasts about domestic abuse. It does a little bit. Anyway.
Is there anything else that you do for your own well-being?
I love reading books about domestic abuse. No, I'm joking. I'll tell you what I've really enjoyed this summer holidays is that we've got this, I told everyone that we moved and blah, 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 blah. We've got this little snug in our new house, and I've really enjoyed just sitting and watching a movie with George, who's my youngest, and
enjoying your new home.
Enjoying that and enjoying him sitting near me, which he doesn't do a lot because we've talked about George has additional needs. But just having that one-to-one with him, that when you're really busy mum and you've got loads of children and you're working, you never have that. Maybe it's just an hour.
Have that time.
Yeah, and I've really, really enjoyed that this summer. Okay, shall we just quickly go through what's happening at Peterborough Women's Aid?
Yeah.
Okay.
It's been a few weeks since we've been on for one reason and another.
It has. Tell me about the ball.
So, our annual ball takes place on the
1st of November. You are right.
Yes. To question myself then. Monday morning. I'm not quite with it yet. So on the 1st of November, it's been held at the Holiday Inn at Thorpewood. You get a 2-course meal, entertainment, disco. There'll be a raffle, an auction, and it's an amazing night. It's just a really good fun. It's quite relaxed, and it's a brilliant night to attend. And that. So if you want tickets, find them on the website. There's a link on there to buy tickets.
So
it's just a really, really fun night.
It's an amazing night. It's only 55 quid a ticket. I mean, that's a bargain. You get dinner, you get a free drink, you get entertained. And it was really good last year, wasn't it?
It was really good fun. And everyone said how much they enjoyed it.
Yeah. So if you go on our Facebook page, there is the link to buy tickets for the ball.
It's also a great means of fundraising for us as well.
It is.
To keep our support services going.
Yes. And then we've got the Great Eastern.
Yes. So, you're running, aren't you? Dressed as a flamingo.
I'm running dressed as a flamingo.
I remember we had great debates, didn't we, about what you were going to dress up as. And you've ended up as a flamingo in a costume now that you realise you can't actually run.
I can't run in. So we're going to alter the costume slightly.
Oh, are you?
Yes. Because the costume that I was running in you needed to have a portable fan. Yes, seriously. To keep it blown up.
Oh, because it's an inflatable.
It's an inflatable. So that was just, the minute we got it on, we were like, how is this going to work? Because I'm going to have to run not only with the fan, but with replacement battery. Anyway. So I am still dressing up as a flamingo, but a slightly different version.
Oh, okay.
And I'm, just to be clear, I'm not running. I haven't trained. Last year I was training so hard, wasn't I? Because I wanted to do it.
Regularly. It's not as though you haven't done anything.
I'm not expecting. I'm expecting to be in the last few. Put it that way, for the Great Eastern.
But your plan was merely to get round this time, wasn't it?
And I'm trying to raise £1,000.
Raise money.
I think I'm on about 400. So if anyone, again, go on our Facebook page, please sponsor me. And I think we've got a few other runners this year, not as many as last year, but we've got.
And if you want to run and raise money for Peterborough Women's Aid, again, there's an email address on the website.
Yeah, it's not too late.
Contact us. And if you raise £150, then we will pay your entry fee.
Which again, it is a bargain. And then just a couple more things to talk about. So I went on Greatest Hits Radio last week and talked about the rise in honour-based abuse in Peterborough, and the fact that the law or the definition of honour-based abuse is changing.
To do a definition, aren't they? There is no legal definition.
Absolutely.
I think that's actually in the process of being agreed, isn't it?
And that there was also going to be training rolled out to professionals on honour-based abuse, which I'm just saying Peterborough Women's Aid already do, don't we?
We do.
We do this for free, and we've got I think we've got nearly 400 professionals signed up on our next load of training. So we're doing honour-based abuse.
In addition to the 2 groups of sessions we've already done last year.
Yeah, we're doing honour-based abuse. Excuse me, FGM, breast ironing, and forced marriage training for professionals. So I think that government initiative about rolling out this training to professionals is really positive. The one thing I was trying to make clear in my interview is that this training needs to be written, created, facilitated by members of the community where honour-based abuse affects that community, because you need somebody with real life experience to be able to deliver that training and make it effective. So I hope, put it this way, I hope it's just not a click on a link.
Yeah.
You know, it needs to be really
read a slideshow and
exactly.
It does make a massive difference when you have someone stood in front of you, like you say, with the cultural awareness and the experience within their community of honour-based abuse and the lengths that people are prepared to go to.
Yeah. And then I just wanted to say thank you to one of our colleagues who did their own quiz night this weekend, pop quiz. Really successful. She raised over £300. So if anyone does want to do an event for Peterborough Women's Aid, please do get in contact. You can contact us through our website, www.peterboroughwomensaid.co.uk.
That's it. We've had people who have done coffee mornings, cake sales.
Yes.
Anything along those lines. Great ideas. One lady jumped out of a plane.
Oh, Gabby jumped out of a plane, didn't she? 9th of August. If people would go on our Facebook, you will see pictures of Gabby literally jumping out of a plane, and she raised about £600, I think, in the end.
That's amazing.
Yeah, really, really, amazing.
It's such a brave feat as well. You'd never get me doing it.
You'd never get me doing it. It's ridiculous.
The idea of having nothing underneath me just terrifies me.
So the question of the week from us is, what does wellbeing mean to you? And you can contact us. You can give us a call on 01733 602 133. You can text on 074 119 1062, and you can comment on our Facebook, YouTube, X or Twitch. So I am delighted, I've semi-introduced them, but we have 2 amazing guests with us this afternoon. We have Danielle Black, who is our Integrated Neighbourhood Programme Manager. Danielle, what on earth does that mean?
It's a very good question. So my role is to work with service providers across wider Peterborough to keep people living well for longer in their own home. In a nutshell, that's what I do. And sometimes we focus on the priorities for specific areas. So we've got 6 integrated neighbourhoods in Peterborough. And one of those, we've launched the Women's Health Hub over at Boroughbury Medical Centre. And that's my role, is supporting in the background, making sure that things happen and that information gets leaked into the community so our community members are aware of what's going on and what's available to them.
So it's all about keeping people healthy, keeping them in their own homes, making sure they can access all of the services that are available to them in Peterborough.
Exactly that. It's about understanding what's available to people in and around the city and further afield to keep well for as long as possible.
Perfect. And what does well-being mean to you?
Well-being means having good health to me. It means having richness in our health and well-being, so having a good way to live, whether that be psychologically or physically. So it's about taking time for you, but it's also about giving time to others so that they can live healthily as well.
That was a lot better answer than I would say, wasn't it?
That was good.
That was a really good answer.
That's what you get from someone in the medical field.
Exactly. And then we also have Dr. Ruth Beasley, who is a GP from Boroughbury Medical Centre. Good afternoon. How are you?
I'm good, thank you. Yes, thank you for having us.
Oh, you're very welcome. It's lovely to have you on the show. What does well-being mean to you?
Oh, I think lots of things. I think from a doctor point of view, with my doctor hat on, it is about looking after yourself, taking those opportunities to access healthcare and well-being, and I think we're going to come on to talking about it later, about making sure you get all your checks done. And I think from a personal point of view, it's about waking up in the morning and feeling good, feeling you've got things that give you purpose or value, things that you enjoy.
Mm-hmm.
I often say to a lot of my patients, we all need to wake up in the morning with something to do and go to bed at night feeling like we've achieved something. And it doesn't matter what that is. That can be a lovely walk around Furrow Meadows. It can be doing some volunteering. It can be your role as a carer or a parent, or all those things give us a sense of well-being.
And I think in our field, again along those lines, sometimes it's about they've managed to get out of bed that morning. They've managed to make themselves something to eat that day.
Yeah.
They've had taken some time to do some personal care.
Yeah, absolutely.
It doesn't have to be some amazing feat that they've achieved. There's all those little things are achievements as well.
And they help build that sense of well-being
Yeah.
and confidence building and all those things that come along with it.
Brilliant, thank you. So, we want to begin talking to you about the Women's Health Hubs. Can you tell us a little bit about how they came about and what are they?
Do you want to start, Danielle, with how they came about, and then I can talk a bit about what they look like?
Yeah, so our Integrated Care Board had some funding that came through via NHS England, which meant we could do something meaningful to serve our people of Peterborough. So what we did was facilitate an opportunity for Burraby Medical Centre to make an offering to our women across Peterborough to come and access a suite of things that could mean that they could live well for longer. So they are things like cervical screening, it could be menopause care, it could be pregnancy health and wellbeing, you name it. So that's the initiative that we built in at Peterborough, and it was Ruth's team that designed that operation, with my support leaning into the community and telling them all about it.
Ruth, over to you. So tell us, if I open the doors of Burraby Medical Centre this Saturday for the Women's Health Hub, what would I see?
Hopefully you will see lots of women coming together to take the opportunity to find out more about their health, how to look after themselves, how to stay well. This is our 6th session coming up on this Saturday, and we've seen the numbers really grow. It's been amazing. It's really exciting to be part of that. It's a female environment. Women are welcomed in. It doesn't matter what your background. It doesn't matter which practice you're registered with. You don't have to be a Burraby patient to come along. You can, any woman in Peterborough are really encouraged and welcome to come and join us. We have an area with lots of different displays and information about well-being, about getting some health checks done, about Flow Cups, which is a menstrual product, which Danielle can chat about in a minute. Lots of other kind of things you can come along and get, things like cholesterol checked, or these kind of different general health things. We're also this month offering vaccination catch-up, and again we can come on to that in a minute. But then it is a one-stop shop. So there is nurses, specialist paramedics, GPs, healthcare assistants, and we can talk about any of the healthcare problems, particularly related to women's health, that you want to talk about.
Wow. And just to reiterate, you do not have to be registered with Burraby. That's really important, isn't it?
It's
That our
really
listeners
important.
hear that.
Yeah, really important.
Any woman from Peterborough can go along to these sessions.
Yeah, the one thing I would say is if you're not registered with us at Burraby, then we can't do prescriptions for you.
Okay.
And what we can do is communicate with your GP on your behalf, obviously with your permission, to help sort that out. So we can help you sort it out, but we won't be able to give you something then and there.
Yeah.
But every woman in Peterborough is welcome to come along, get that information, have a chat with the specialists, have their questions answered, their concerns addressed, in a really positive, friendly environment. I've really enjoyed them. I've really enjoyed spending time in them and chatting to the women that have come along.
And why do you think it's so important that it is for women only?
I think for lots of reasons, women often feel more comfortable in that female environment. I think people can be a bit anxious sometimes about who they're going to bump into, who they're going to see. Knowing that it's that female environment, we know that women are really, really good at supporting each other. It's something we're good at. And actually to have that environment where there are other women who feel they can openly ask questions. There's the opportunity to have group discussions as well as one-to-one private consultations. Both those things are available. And sometimes, someone might ask a question that you've been kind of wanting to ask, but you are a bit shy or a bit embarrassed, and someone else asks it, and that can be really helpful as well. So yeah, it's a safe environment. We control who comes in and out. it's all female clinical nursing and medical staff, so people hopefully feel much more comfortable in that environment.
So why do you, from your angle, I suppose, doing the work that we do, why do you think that is so important for the clients we work with, that it is a women's only health hub?
Well, that's it. I think because when we're coming from a situation where women have been abused predominantly by men, they can feel extremely uncomfortable, even in the company of a man. Being in the same room, let alone discussing, what they consider very personal and private difficulties that they may be having. So by providing that all-female environment, it can have a massive impact on them and make them feel much more comfortable and much more at ease.
Yeah.
And I think it's about having someone that you're talking to that you feel understands where you're coming from.
Yeah, absolutely.
And we've also, from the work that we do, obviously we have a very diverse workforce at Peterborough Women's Aid, but we also know that our staff and the clients that we support will be very apprehensive about going somewhere if they might have a male practitioner. And that might actually be a huge barrier for them not seeking help. So the fact that we know that as women we can go to the Women's Health Hub, it's all female staff, there's all women, that immediately that barrier's kind of gone, isn't it?
I think as well, if people have been physically or sexually abused, having a physical examination, for example, they can find that really, really intimidating.
Yeah.
So it's scary for women to attend appointments. So having a conversation perhaps beforehand, and having that reassurance that it'll be very much taken in their own time. You'll obviously explain as you go along what's going to be happening. It can have a big impact and can make people feel more relaxed about having those examinations done.
Yeah, absolutely.
And like you say, sometimes there's people who want to ask the question but are too scared to ask the question for whatever reason. So if someone else asks it, it can sometimes make it easier as well.
And we know, for example, with smear tests, with cervical smear tests, which we really encourage all women who are eligible to have, and it's women aged between 25 and 64. So if you are in that age group and you're not sure if your smear is due or not, you can phone your GP and find out, or you can pop along and we can check. At the moment, smears are every 5 years. That has changed recently. It's a bit more often in certain situations. So again, I think I'd really encourage any women who thinking, I'm not sure, I can't remember, check. Ring the doctor's surgery, pop into the clinic, we can check and let you know if it is. But as you say, there is a lot of women who are really anxious about having that smear test done for lots of reasons, but one of the common reasons we do see is when they have experienced some trauma associated with that part of their body for lots of different reasons, and we can really take the time to work through that with those women and support those women to make it as positive experience as possible.
So if someone's been notified that they're due a cervical smear and they've perhaps put it off and put it off and put it off, you're quite happy for them to turn up, have that conversation, and
absolutely
you can carry out the procedure.
Absolutely. I think the most overdue smear we've had, I think, is someone who was 24 years overdue, and they came and had it done, and it was normal, and they'd been terrified and they'd been putting it off for a really long time, and we've had women come who've never had a smear and don't really know what to expect or what's going to happen, and again we can go through them with them in a really gentle, slow, calm way, how it's going to work, what's going to happen, how we can make it as comfortable for people as possible. It only takes a few minutes. It really does.
I think like you say, it's about breaking down those misconceptions that they're going to be sort of thrown in this room, they have to strip off, whatever's done's done, and then they're out the door.
Yeah, absolutely. And it is, it isn't like that at all.
No.
We can take as much time as people need, but actually it is a quick procedure. We are totally comfortable with doing it. People think people are going to feel awkward or embarrassed or whatever, and we totally don't. We've all had them. And it is a little bit uncomfortable for people to imagine having that done, but actually it's a really quick, really straightforward procedure, and it really does save lives, and it really does make a difference, because if we find this virus that can live on the cervix and cause you to be more at risk of cervical cancer in the future, we can do something about it really easily and really straightforwardly.
Quick question. If I am not sexually active and have never been sexually active,
Mhm.
should I still come for my smear?
The guidelines is changing on that. We used to say yes.
Okay.
We tend now to say if you've never been sexually active, then it is extremely unlikely that you will have this virus, which we know causes the majority of cervical cancers. But what I would say is come along and talk to one of the specialist nurses about it. Talk about what your risk may be from potentially other activities. Talk about any things we would ask people to look out for, like abnormal bleeding or abnormal discharge, which could indicate something else is going on. So yeah, you may not need a smear test as part of the screening programme, but it's certainly important to be aware of health in that part of your body.
Right, okay, so the message is basically go along anyway and have that conversation
Absolutely.
with somebody, because my definition of not being sexually active might not be somebody else's definition of not being sexually active.
Stay
So we need
tuned to
be-
Salam Radio after this short ad break.
Craving authentic Desi flavors? Look no further than Desi Restaurant. From midday until 1 in the morning, enjoy our homemade specialties that will transport your taste buds. Indulge in tantalizing papri chaat and savor the rich Chersi Kadahi. Treat your friends to our fresh 1 kilogram Chersi lamb handi. Plus, get 2 12-inch pizzas for $11.95. Located at 298 Lincoln Road, we deliver from lunchtime until 1 a.m. Call 01733 555 795 now to order and experience Desi Restaurant's flavors.
Craving a heavenly escape in the heart of Peterborough? Heavenly Desserts is the perfect place to relax with friends, unwind with family, or for casual meetings with colleagues. You can now indulge in our delicious brunch menu with mouth-watering savoury delights, served from 11 a.m. every day. Visit us today at Cowgate, Peterborough, the go-to spot for good times and great company. Where else but Heavenly's? Party packages available for birthdays and other celebrations. Also available to order through Just Eat, Deliveroo and Uber Eats.
2020 World Buffet is inspired by the best foods from around the world. See our teppanyaki chefs grill your food to order, or choose delicious Indian, Italian, Chinese, Mexican dishes and British favourites, all halal. 2020 World Buffet offers you unlimited food at a set price. Open 7 days for lunch and dinner. Catering, wedding and party services available too. Call 01733 566 320 or visit 2020buffet.co.uk. 2020 World Buffet, 35 New Road, Peterborough, PE1 1FJ.
There's simply a variety of choice at Chicken Valley, 318 Lincoln Road. And we don't just mean whether you dine in or order for takeaway or delivery. With halal dishes including peri-peri chicken, wings, strips and wraps, Korean burgers, sides, milkshakes and so much more. You'll have to experience Chicken Valley again and again and again. Open 11 a.m. until late, every day of the week. Order delivery via Just Eat, Uber or Food Hub. Or for collection, call Chicken Valley on 01733 564 053.
Whether you're eating in or ordering for collection or delivery, Big Mouth at 349 Lincoln Road in Peterborough is the place for all the family favourites you know and love. But now it's even better, as loaded fries, grilled and smashed burgers, peri-peri strips and wings have been added to Big Mouth's mouth-watering menu of pizzas, chicken and so much more. Call in today, order for delivery via Uber Eats or call 01733 201020. Big Mouth's open 11 till 2, 7 days a week.
Busy Bunnies Nurseries is where children grow and thrive. It's where your little ones will enjoy expert care, engaging activities and a warm, welcoming environment. Busy Bunnies Nurseries also provide great learning experiences in exceptional indoor and outdoor settings. So when looking for a loving, fun and safe place for your child, visit at 627 Lincoln Road, Peterborough, now with additional parking, or online at busybunniesnurseries.co.uk. Call 01733 897799 to book your visit today. Busy Bunnies Nurseries, where children hop into a brighter future.
It's healthy, nutritional and halal. It's The Lads, your first choice for burgers, pittas, wraps and flame-grilled lamb chops and peri-peri chicken. Now with 5 fantastic new flavours, plus sides, grilled salads and milkshakes too. Open daily from 11:30 until 11 p.m. Call in at 15 Cowgate in Peterborough. Order for collection online at thelads.co.uk or by calling Peterborough 562287 or place your Lads delivery order at ubereats.co.uk.
This is Salam Radio, Peterborough's Muslim community radio. Broadcasting on 106.2 FM and online.
Good afternoon. You are listening to Keep Women Talking, a show from Peterborough Women's Aid. I must apologise because before the break I was so involved with a conversation about cervical screening that the ads just came on literally mid-flow, didn't they? But the message from us is please go to your cervical screening, and if you feel like you want to discuss something or just feel generally uneasy, we do have the Women's Health Hub this weekend at Boroughby Medical Centre. I am joined today by Danielle Black, who is our Integrated Neighbourhood Programme Manager, Dr. Ruth Beasley, who is a GP at Boroughby Medical Centre, and obviously my lovely co-host Sue. And we are asking you, what does well-being mean to you? And you can call us on 01733 602 133, text us on 074 119 102. You can comment on our Facebook, YouTube, X or Twitch, and we have some comments from Jane. So Jane says that well-being for her is taking care of herself. She likes to have her nails done and have a massage. She likes spending quality time with her family and friends, sitting around a table, chatting, eating, and she also loves to go out on her paddleboard. Oh, I love a bit of paddleboarding. Do you guys paddleboard? Do you paddleboard?
Not so good at standing up, but I do like to be on the river. More often in it than on the paddleboard.
Yeah. It's fun though, isn't it? I like paddleboarding. Yeah. So we are talking about all things women, all things health, and we're now going to talk about flow cups. Now, I'm going to put myself out there here and say I don't even know what a flow cup is. Well, I kind of do, or how it actually works. So, Danielle or Dr. Ruth, can I ask one of you to explain, the intricacies of a flow cup, please?
Yeah, sure, I'll go for it. I wish I bought one to show you. So, a flow cup is a device to manage your periods, and it's one that you can reuse for up to 10 years. It's made from silicone and it's very bendy and very comfortable. So if you imagine how you would insert a tampon, it's a similar thing to that, but much more comfortable. And you can use it for much longer without having to change that throughout the day. So it's really good for your vaginal health, but it's also good for our environment. So when we invest in these, they're about £15 for a whole set. You can not make any contribution to landfill for 10 years, which is just great, isn't it?
Yep.
It looks after our planet. But at Boroughby, at our Women's Health Hub, we've bought 2,000 to give to our women of Peterborough so that we can serve people that may be living with period poverty, that don't have access to sanitary products, because we want people to feel confident to go to sports sessions, go out walking, go to work and have a good life through managing their period. So if people want them, they want to try them, they want to learn about them, it's the place to go. Next Saturday, 2 to 5, grab your flow cup.
So, can I swim?
Yes.
I can swim, I can do sports.
Yes.
Suitable for
everything.
Regardless of whether your period's light or really, really heavy.
Absolutely. They're absolutely amazing. I use one myself, and there'll be no more going to bed and being worried about leakage. It gives you that absolute privacy when you're sharing a room, perhaps with a friend or family members, etc. You are not going to leak like you might do if you had a sanitary product such as a sanitary towel.
And sanitary products are so expensive, aren't they now?
They really are.
And if you imagine if you're a mum with, 3 girls, you're talking, if you're all on your periods at the same time, you're talking £20, £30 a week just on sanitary products, aren't you?
Absolutely. And the thing about these, that we call them devices, but that sounds a bit technical. They're so comfortable that even people that haven't had children can wear them. So you're talking your young adults. They don't interfere with being a virginity like some people think. They're very safe to use, even in young teenagers as well, so that they can carry on going to sports, perhaps horse riding, running, etc. Anything where your period stops you doing your daily things that you love to do, these flow cups can really help.
And toxic shock syndrome is not a thing with these, I would imagine.
Absolutely not, no.
Okay.
As long as you're emptying and cleaning them as you're guided to do, you'll not face a problem at all.
So how would I kind of take it out and wash it?
Yeah.
What's
Yeah, take it out, empty it out into the toilet, wash it with soap and water, package it away, ready to go for next time if you finished your period. But you can carry on using it, and you don't have to interfere with it for 12 hours a day. You can just leave it where it is. It's amazing.
You just need one.
Just one.
One of the we've been handing them out to quite a few women, and one of the feedbacks we had was a young woman who was going off travelling, and they're absolutely perfect. When you're packing your rucksack, you're working out, you know, what you're taking, you're not quite sure when your period's going to come, and you can just take that with you. That was, it's really great for that. And also people heading off to sort of university, that kind of thing around now. Mm-hmm. Again, it's thinking about what you need to take with you, and being in a different city, whatever. Again, they're really handy just to have in your bag. You've got it with you. You're good to go. Whenever you need it.
They come in a little Hessian bag, so it's really discreet. So only you know what it is. It could look like a piece of makeup to anybody else.
Yeah.
I love this, Sue.
Yeah, I've never thought about using one.
I tell you what, I think because I didn't really, this is like my naivety here. I actually had visions of like a cup somehow being sucked on. I don't want to go into too much detail there, but I think you know what I'm saying. I didn't know how easy it was, and also how long you could wear it for, because that's huge, isn't it? Especially with young people. It's embarrassing having to get up out of class and go to the toilet.
And nobody enjoys the bit time of the month, do they?
No, they don't.
So anything to make it as easy as possible.
And you guys are giving these out for free at your women's hubs on the 6th of September. Are there any, if we've got some listeners who couldn't get there, are there any other places where they can access these for free?
Yeah, certainly. So we've dropped some off at Women's Aid, we've placed some in our family hubs, and if messages come in around places that are most suitable, trusted places, I'm happy to drop more off into those locations as well.
Perfect. So if there are women out there that can't make the hub on Saturday but would benefit, or they've got a group of women that benefit, they can basically contact us at Peterborough Women's Aid through our website, and we can pass on the information where would be a good kind of collection point for people.
Yeah, perfect.
Amazing. Really, really good. Okay, so we are asking you, what does wellbeing mean to you? And you can call us on 01733 602 133. You can text on 074 119 1062 or comment on our Facebook, YouTube, X or Twitch. Okay, so the next thing I want to talk about is vaccination catch-up clinics. I haven't been a young mum. That makes no sense. I haven't been a young mum. I haven't been a mum with young children for some time. And I always felt slightly like what happens, the vaccine happens at 4 weeks, and then back in my time, we had the MMR, did we? So I'm looking at Sue for guidance, because this is going back years, isn't it now?
My children are older than yours.
Yeah.
I don't know why you're looking at me.
And we had and the vaccines were in their little thighs, and it was awful, and they used to scream, and everyone hated taking their children for vaccinations, but vitally important.
Absolutely, and I think also you're talking about vaccinating children, but as a mum, you tend to focus on the children and you forget about your own. So I think very often we've found that adults have missed vaccinations along the way as well.
Yeah, and some of the clients we work with who are vulnerable, who, for example, need the flu vaccine, haven't, because they're focusing on other things. So tell us more about the vaccination catch-up clinics.
So we know that across the country, and certainly in Peterborough, people are not having their children vaccinated as much as we would like them to, and as you see, people aren't even having their vaccines as they get older as well. And we have sadly seen a little bit of an increase in measles across the country, which makes us very nervous. We know that to get what we call herd immunity, which is where the majority of the population are vaccinated against a disease that could be deadly, we need to get about 95% of people vaccinated. And we know in Peterborough that we are way below that.
And this has been in the news
Way
over the
below that.
weekend, hasn't it?
has.
The vaccination rates are
Yeah.
falling.
So we would really encourage everyone to make sure that their children are vaccinated. Again, you know, I'm a mum, and I remember, you know, when my children were little, it's not a nice thing to go. You think, you know, as a mum or a parent, your biggest job in the world is to protect this child, and suddenly you're taking them to something that's going to make them cry and might make them a bit poorly. And it's hard when it goes a bit against what part of your brain's thinking you should be doing. But from a doctor point of view, a mum, you know, and a mum point of view, it is just really, really important. And I always share this story, and I'm very happy to share this story. When my son had his first MMR vaccine when he was 1, a few days later he was quite poorly, and he had a fit, which is really rare but can happen occasionally. It can happen after an injection, but it can happen after any illness where children get high temperature. And I was terrified about him having the second MMR. So I kind of delayed it, being a rubbish doctor, but trying to be a good mum. And I delayed it. And then I got a phone call to say that a child in his reception class at school had got measles. And it was terrifying. I was terrified. I phoned the doctors up straight away, booked him in. He had his second MMR straight away because I was really worried I'd done something that was going to cause him harm in him, you know, not having that vaccine. He had the second MMR and he was absolutely fine. Had absolutely no problems at all.
So you're saying that your son had a seizure. That's obviously quite an unusual side effect.
Yeah.
What are the general side effects to having vaccination?
The vast majority of children don't really have any problems at all, actually. And we often say that, you know, you can give a dose of paracetamol or Calpol or whichever, just to, you know, settle down any slight temperature or slight, you know, irritability. They might have sometimes they get a little bit of a rash, something like that. Those symptoms are nothing compared to getting the illness. Even the febrile convulsion, the fit that is, like I said, extremely rare but can happen when a child gets a high temperature for any cause, is much more likely to happen if they catch measles or they catch, you know, one of these illnesses with whooping cough, you know, again, which has been in the media recently. So you're far safer to have the vaccine than not.
And measles, that is a very dangerous disease. That's what you're saying. And I think maybe because people have been being vaccinated, we don't hear that enough, do we? That actually it's life-threatening, I'm guessing. Yeah.
Unfortunately, people do die from measles. Children die from measles every year, particularly in unvaccinated populations. And, you know, in terms of the vaccine catch-up, again, we know that sometimes when you have got, you know, young children, maybe 2 or 3 children under 5, things get missed, you lose track, you can't quite remember which vaccines they've had. Again, a little bit like the cervical screening, if you're not sure, come and ask us. If you're not sure, pop into your surgery or give them a ring and check.
And is it ever too late for a child to have it? So if if I'm suddenly freaking out that my 12-year-old might not have had the MMR jab, it's not too late.
It's not too late. We can vaccinate adults who've, you know, missed childhood vaccines, and again, that's something we've just been looking at recently at Burberry. We've just been in contact with all our 18 to 25-year-olds who we haven't got a record of them having the MMR when they were 1 or 2 for, you know, a whole selection of reasons. Possibly like me, their parents were really worried about it, or possibly they've come from a different country where the vaccination schedule's different. And so again, we're offering these catch-up clinics where we can vaccinate anything that's been missed at any age. There's also other really important vaccines that come in a little bit later, and again, going back to the cervical screening, we now do a vaccine called HPV, which has been around for a few years. It's given to young adults, young teenagers, boys and girls, and that's one that we find is missed quite a lot. And that protects you from catching this virus that can then go on to cause cervical cancer.
And that is normally done at schools, am I right?
It is. It is done at schools. And again, what we're seeing at the moment is, because it's done through the schools, partly if you're not in school that day, you miss it.
Or you change school, for
or
example.
you moved schools, or you were, you know, you didn't feel well and you didn't have it. And also we're still seeing a few where it was missed through COVID, when, you know, people were having extensive periods of time, either with the school being shut as part of lockdown, or, you know, they sat diagonally across from somebody in the class that had COVID and they had to have 2 weeks off, and all those kind of things we probably all remember. So there is quite a lot of young adults that have missed some of these school vaccines because of, you know, these various reasons, which are, you know, often out of their control.
And you said it's HPV, isn't it? That it is for boys and girls.
Yeah.
Now, my son, I think, had his at school maybe last year. He's 14.
Mhm.
He would have been 14, 15 or whatever. And I naively said to him, well, no, that's just for girls.
Mhm.
That's for cervical cancer. But it's not. Tell me why boys have it, I suppose.
Because, again, it's about trying to create that immunity across a population. And we know that if boys have got this virus, they can pass it on to girls. If
So they can carry
everyone's
it as well as females.
immune, you know, whilst it's not going to cause the boy any problems, it may be in future time
Mhm.
it causes his girlfriend a problem, or his, you know, partner a problem, his wife a problem. And so actually to get that immunity across the population is what we're trying to achieve with all vaccines, really. And that's why it's really important, even if you don't feel that you may be at risk, people around you may be
Mhm.
vulnerable, elderly relatives may be vulnerable, you know. We don't want children taking, you know, infections in to visit their grandparents, or, you know, perhaps someone who's pregnant, and, you know, so for all these reasons we try and get this immunity in as quickly as possible to as many people as possible. And like I said, it is, you know, whilst some children do have little, you know, slight reactions, it is so much safer than catching the illness. And that's what's really, really important. But again, we know that people worry, we know that people have questions, and it's totally okay just to come and ask those questions. You don't have to have the vaccine then and there. If you'd like to just come and get a bit more information about it, you know, ask a few questions, we can go through and do all that.
And again, excuse me, if people can't make the women's health hubs, they can just go to their GP and say, look, I'm worried that my daughter or whoever hasn't been vaccinated, can you check the records?
Yep.
And I think the clear message here is that it's never too late, isn't it?
Absolutely.
And that we must, people must get their vaccines.
Yeah, absolutely. And I think one of the things we see in Peterborough that we're really aware of is we have a really diverse, multicultural population. We have a lot of people that were perhaps had their children in other countries, or perhaps grew up themselves in other countries, and not really sure what vaccinations they've had, not really sure whether they've missed out on things that we would be encouraging here in the UK. And again, we can catch all that up. We can check what you've had, or check what we think you might need. It's always better to have the vaccine than not have it. So if we're not sure whether someone's had something, perhaps in a different country, we can give it again, and it's safe.
Yeah.
Brilliant. I love that. That's just the message there is so important, isn't it? That in Peterborough, what we're trying to do is get everyone vaccinated. We're going to get everyone the opportunity to go, reduce the barriers to vaccinations, and also be able to answer people's questions if they are concerned.
Absolutely.
Amazing. Okay, I'm looking at the clock because we're going to talk about a very current subject for myself. And I'm not going to say anyone else in the room, but it might affect other people in the room. We are going to talk about the menopause. I've got so many questions. I could be here for hours talking about the menopause. Dr. Ruth, can you tell us the most common things you are seeing from women who are premenopausal or menopausal, and what are the conversations you're having, and how are you helping, I suppose?
Okay. So yeah, I think menopause is something we are much, much more aware of now than we used to be, but there is still an awful lot of women who are suffering and don't know what it is, and don't know what they can do about it, and feel unsure, or just don't know where to turn. There is still lots of confusion out there about what menopause is, what it isn't. So just to kind of be completely clear, you've had the menopause when you've not had a period for 1 to 2 years. You are having the perimenopause when you are having all the kind of symptoms around it, but you're still getting some bleeding, which may or may not be regular. Most women go through the menopause, so they have their last period and then that's it, sometime around their early 50s into late 40s. Most women experience perimenopause any time from sometimes even late 30s, but certainly early 40s onwards. Women can be getting some of these symptoms, and they often don't think about the menopause because they're still bleeding, they're still having periods. And I think some of the most common things that women come and see us about and perhaps don't realise is the perimenopause is feeling overwhelmed, feeling anxious, feeling stressed and tired, feeling like they can't cope with things they used to be able to cope with. We know that lots of women in this period of life, you know, start to not want to take on perhaps more responsibility at work because they don't feel they can cope with it, or they are, you know, not sleeping well because they're getting some, you know, hot flushes and sweating. They're embarrassed about that in the workplace, so they are kind of avoiding going into more, you know, challenging situations and things like that. And it's all this kind of really going back to what you talk about with well-being. People's well-being often deteriorates in menopause. Not for everyone, but a lot of women just feel less confident, less good about themselves, more self-conscious, and that can happen in, you know, years before the actual last period happens. So that's why, again, we would encourage women who are feeling those things, rather than just thinking, oh, this is something I have to put up with, or this is midlife, or, you know, I always think, this is a really exciting part of our lives, and we should feel well in it, and we should feel we can come and talk to people when we're not. And the other thing we know, again, with this group of women is it's really often that super challenging part of your life where you've got still children who you have responsibility for, even though they may be growing up, but you've also then got elderly relatives and parents who you're starting to have responsibility for as well, and that can feel a bit overwhelming too. So, you know, it's, you know, at that time we would really encourage women just to come and talk to us, do some research, ask questions, and we can go through what options are available.
And what are the options? If I came to you and I said I'm having this massive list of symptoms, what are the options for me?
So there's lots of kind of general wellbeing things we would encourage women to do. You know, you mentioned earlier that you like going to the gym and that kind of thing, which is brilliant. And I think, you know, we would encourage women to exercise, to get outside, to take some time for themselves, to do all those general wellbeing things, to eat well. But for a lot of women, that's not enough. Or it's really quite difficult and quite challenging if they've got care responsibilities, or, you know, the idea of going to the gym is just terrifying, or financially not an option for them. So the other area that we look at a lot is HRT, which again, you know, a lot of women will have heard about. It's had very mixed messages over the years. Certainly I've been a doctor for 20 years, and in that time HRT has been up and down as to whether it's, you know, the thing or not. And then we had the whole kind of, you know, Davina and, you know, lots more information out there. The evidence that we have now is that HRT is very safe. And for the majority of women, it's very safe. It is something you need to have a consultation, you need to speak to a healthcare professional about, and, you know, at the Women's Hub we have some menopause specialists, and lots of doctor surgeries around, you know, Peterborough will have menopause specialists who can go through this with you and look at exactly whether it's the right thing for you. But for the majority of women, HRT is a safe option that does help, and it does make an awful lot of women feel more like them again. That's probably
so it eases the symptoms, not necessarily gets rid of them completely, but it can ease them and make a big difference.
And in some women it does get rid of them completely. And again, I would say to people, if you are on HRT and you feel like it's not really working for you, or you're not really feeling any improvement, come back and have another chat, because there are slightly different ways of taking the HRT, there's slightly different formulations of it, and we do sometimes need to kind of try out different things to get the right dose and the right combination. And what it does really is it lifts your hormones back up to where they should be. So it's not making your hormones super high or doing anything, you know, weird. It's just lifting you from where your hormones are kind of going up and down to just lifting them and then smoothing them. So you have just a more continuous level of hormone, which then helps with a lot of those other symptoms.
we briefly spoke, didn't we, when you came in, that I was on HRT, didn't feel like it was doing anything, came off it, and now it's all got worse. So I am going to take Dr. Ruth's advice, and I think my issue, and I think maybe some women might have experienced what I experienced, is that the doctor that I went to see just basically said, yes, take this and this and this and off you go. And there wasn't any explanation around what it's going to do to my body, how long it will take, all of this kind of stuff. So, but you're saying that some surgeries do have menopause champions.
Absolutely.
And they might be a better person to talk to if you're having these symptoms.
Definitely.
And will be a little bit more maybe understanding.
Yeah, definitely. And I think, if you've had an experience of a menopause consultation and you don't feel you've got the answers to all your questions, it's okay to go back. It's okay to ask to speak to somebody else. That's the right thing to do. This is important and it matters to get it right.
Yeah. Amazing, thank you so much. I cannot believe it is the end of the show. I've got so many more questions. We might have to have Danielle and Ruth back on, but thank you so much for coming in and sharing your expertise and wisdom with all health things. Please do the Women's Health Hub, Burraby Medical Centre, 2 till 5 on Saturday the 6th. Thank you, Sue. We will be back in a couple of